Hello, I'm Dr. Fulton, and I'm proud to be here with Vivant Skincare, talking about the progressive peel, the Propeel, the peel we designed that's safe for all skin types, especially for Asian and ethnic skin. So come with us as we go through this Propeel tour. Our objective was to provide mid-depth rejuvenation without the use of caustic level chemicals. We didn't want to use 70% glycolic acid, which can cause reactive hyperpigmentation. We didn't want to use 40 to 70% TCA, which can cause hypopigmentation or loss of pigmentation and also scarring. Or we didn't want to use strong phenol, which can be toxic to the heart. So we went through and worked on a system, progressive peel, that allowed us to use very light chemicals in a progressive way so we could watch the different skin types as they react. So we devised the Propeel 1, 2, 3, and 4. 1 is a modified Yesner. Remember, Yesner by itself contains resorcinol, and some people may get allergic to resorcinol, and we didn't want that to happen in the middle of our Propeel. So we took out the resorcinol and added some natural moisturizers like urea and sodium PCA, along with citric acid, salicylic acid, and lactic acid. We found this combination to actually give us a better peel when combined with TCA than the old-fashioned Yesner peel itself. Level number 2 is Propeel 2, which is combining these natural moisturizers with salicylic acid and trichloroacetic acid, 7.5%. Trichloroacetic acid is a safe acid. It's like vinegar, acetic acid with chlorine groups added, that gives us a nice, safe peel. At 7.5%, we can watch it as it progresses through the skin. And at the point that we get a blotchy, foggy red blanch, we can stop. But some patients need more, so we go on to Propeel number 3, which is twice as strong, 15% TCA. And some people with oily skin need to go this level and may need 3 or 4 coats to get that foggy red blanch that we need to see as we cook this egg slowly to get a nice soft-boiled egg. And to make sure that everybody has a uniform peel, we do the high-dose retinoid peel. So Propeel number 4 is our high-dose retinoid, our vitamin A propionate. We put 3 coats of that on to make sure we get a nice peel from the hairline into the décolleté area. So these 4 peels together allow us to watch as we progress in our peeling, so we get a nice peel without any kind of a severe reaction. We want to go to the mid-depth area. We want to go deeper than just the epidermis, but we want to stay away from that sebaceous gland, which would be like a burn grade 3. And once we would be at the sebaceous gland, we risk scarring. So we're in the mid-dermis and above to get new collagen, new elastic fibers, new hyaluronic acid, plus a nice smooth epidermis to give us a rejuvenation and a lightening effect. This particular peel is good for many conditions. We like to use it for freckles, we like to use it for melasma, for active acne, and fine lines. If we have really heavy lines of an old smoker, or blood vessels that are dilated, or bad acne scars, we need to go beyond this peel to a facial sanding. But for most patients, they'd like to go through the step-by-step program so they can have a nice rejuvenation without taking time off of work. This is an example. This 16-year-old acne boy was using our complexion kit 1 and then our complexion kit number 2, but it was still breaking out. So we added to it a series of 3 Propeels, which peeled out all of his acne impactions, and then he was able to go back to our clear complexion systems and stay clear. So it was a great addition for him to help his skin stay clear without the use of Accutane. This patient had a lot of sun damage and had too many fine lines, so we put her on the skin rejuvenation kit, the anti-aging kit, along with her glycolic microdermabrasions and a series of Propeels. And you can see her nice rosy red youth look of adolescence as we've got rid of most of the lines, and she's a real happy camper. This is Osvelia, who has melasma. She inherited it, but with her pregnancies it came out. After her pregnancies, we were able to put her on the Even Color skincare kit, to do a microdermabrasion, but finally do a series of 2 Propeels. And after the Propeel, put her on bleaching cream 222 and gradually get her back onto the even color kit, and you see that her melasma has disappeared. Now, it may come back if she gets pregnant again, takes a high dose estrogen like a birth control pill, or spends a lot of time in the sun. So she still has melasma, you just can't see it now because we've improved the complexion and got rid of the blotchy brown. This is the airline stewardess who flew at 40,000 feet and got a lot of UVC, the short UV, through the window glass and developed these actinic keratoses. With her, we were able to do 3 Propeels and to use extra of the Propeel number 3 on the keratoses to peel off these impactions. So at the end, when her skin is peeled off, the keratoses are gone, and she never looked like she flew at 40,000 feet. We like to grade our patients and do a little survey. We call it the aging index. We measure the number of freckles, we measure the number of fine lines, the pebbly appearance, the dilated blood vessels, the actinic keratoses, add it all up and get a score. Now, if you have a very light score, 1 to 9, you can just do skincare. Really push the skincare for a year and you'll improve your complexion. Other patients that have a higher score, up to like 19, need to add the glycolic microdermabrasion to their skincare program to improve their index. Some patients are beyond that. They're a little higher up, between 20 and 29 the score, and they need to add a series of Propeels, maybe 3 during the first year, along with our previous steps to really achieve their goal. Now, some patients, smokers, acne, valleys, have to go to step 4, which is more than 30 on their index, where they need a facial sanding added to their step-by-step skincare program. So the 5-step program is the same for everybody. You got to start with step 1, avoid free radicals. By that we mean you got to stay out of the sun and not smoke. Every time you take a puff of cigarette smoke, you inhale 40,000 free radicals, and it's impossible to get an improvement on your complexion if you're smoking or playing golf every day. So you must come to us mature enough to stay out of the sun and not smoke. Then you want to stimulate your skin's own repair process by using your buffing grains and using your glycolic normalizing tonic, and add to it the vitamin A conditioning lotion. Vitamin A goes right down into the nucleus of the cell, kicks off new cells, an essential vitamin for the skin that produces cells that don't stick, that give you that rosy red look. After that, you need to add to it the complexion peels with the Propeel, and later on, some of the cases with sagging need to do mesotherapy or the light therapy to pull up the skin and end up with their pleasing improvement. Smoking, step 1, is really bad because you take a puff of smoke, it goes right into the mucous membranes, right through the skin, and destroys the collagen. Remember that we lose 1% of collagen a year, but if you're a smoker, you lose 10% of collagen a year. So smoking is not a good idea for your skin. We want to really push on then to your rejuvenation program. The buffing grains will strip off the dead skin cells. The alpha hydroxy acids take apart the desmosomes, open up the skin, so the vitamin of skin, the vitamin A, can go down, get into the nucleus, generate new cells that proliferate at a rapid rate. So we want to speed up the natural proliferation, which takes 28 days, speed it up to like 14 days. So when we do our complexion peel, it'll heal really quickly. So we put this all together in a system. It's like the buffing grains, which buff the skin off. Ronnie Marks in England has shown that if you buff every day and take a biopsy at the end of the year, it looks like retin A. So by just buffing the skin and stripping the dead skin cells, it forces our skin to generate new cells in the epidermis and in the dermis. We get new collagen, new elastic fibers. To really help, then we do a normalizing tonic cleansing after that with the alpha hydroxy acids to take apart the desmosomes so our vitamin A can sink in. During the day, we wear the day treatment cream with the sunscreen and the high zinc, which is anti-inflammatory, and zinc is also an essential vitamin for collagen production. So altogether, this kit gives us a lot of rejuvenation. We want to really move our healing from just the burn on day 1 to like a burn that takes like 3 days to peel off. If you're doing your skincare program, you're moving it back so you can proliferate right away and save like 2 days of wound healing and get a rapid repair of your Propeel, rapid peel, and get back within 4 or 5 days to work. This pre-preparation of the skin is now standard. This is Gary Monheit's little notes from the University of Alabama, and it's well recognized now that the preconditioning of the skin is standard now for peels. So everybody's doing it. You must do it to get the best result. The blonde skin is easy. Dr. Aronson, a famous ENT surgeon in Beverly Hills, said blonde skin, Swedish skin is like a cakewalk. But as you get darker skin, you must condition longer, and you must drop down the percent of the TCA. Some people with ethnic skin or Asian skin can get a very nice result just by doing their step 1, their modified Yesner, their step 2 with a 7.5% TCA, and then jumping over 3 and use the high-dose retinoid peel. The vitamin A propionate goes down in the skin. The enzymes of the skin convert it to the vitamin A acid, and they get a nice uniform peel from our hairline in the décolleté area. And for Asian skin, ethnic skin, it's a safe peel. This is an example. This is Richard, who just used our skincare kit. He had a low score, less than 9 on his aging index. He just used our rejuvenation kit every day, twice a day for a year. And you can see his results. It looks like he had a facelift. The blotchy brown is lightened up. The lines have pulled up, and he has the kind of the rosy red hue. So he's very happy with his results, and will plan to continue on with his skincare program for years, basically the rest of his life. This person, though, had a little more damage. There were more fine lines, and had to add to this program the glycolic microdermabrasion every couple of weeks or once a month for a series, and along with the skincare program, got a really good improvement, but was beyond what just products would do by themselves, and had to add the microdermabrasion to it. This patient liked to walk in the Alps in Switzerland and got a lot of damage during the summer. So she needed a little bit more. She got out of the sun, she did her little skincare program, she had her microdermabrasions, but more important, during her first year, she had a series of 3 Propeels, which sloughed off the dead skin cells, opened up the skin, let the vitamin A work better, and you can see her nice result here, where she's got youth. She looks much younger. She looks 29 and holding, and not like an old hiker in the Alps. So let's do a Propeel. Let's walk through it together. This is our Propeel solutions. Propeel 1 with the modified Yesner solution. Propeel 2 with a 7.5% TCA. Propeel 3 with a 15%. And then our polishing, our icing of the cake, the high-dose retinoid peel, the 10% vitamin A propionate, that will make sure that we get a nice peel. And we'll peel from the hairline down to the décolleté area. So we start out, after the skin's been conditioned, with Propeel number 1. We put on 3 or 4 coats of that until our little gauze comes back clean. Then we go on to Propeel number 2 and apply 3 or 4 coats of that and watch for blanching. If there's no blanching, there's no foggy white blanching, I'll move on to Propeel number 3, apply 3 or 4 coats of that, and then end up finally with our high-dose retinoid kind of frosting at the end to make sure that we haven't missed any areas, that we get a nice uniform peel from earlobe to earlobe and hairline to the décolleté area. So this is our tray. We want you to set your tray up the same way, and notice that big bottle of water. Why is the water there? And the reason is that many patients think this is surgery, and so they're like NPO, nothing by mouth, when they come in, and they're dehydrated. We want to flush out any chemicals that get into the system, so we recommend 4 bottles. Drink 4 bottles of your water during the first day to flush everything out. In addition, we have a little bottle of eye wash solution. I've never got into the eyes, but I want to have it there just in case. So if we do happen to get a drop in the eye, we can wash it out very aggressively with the eye washing solution. Then you'll see our 4 bottles. We're going to progress through those. Then we use the Obagi 3x3 or 4x4 old cotton gauze, because we actually get an abrasion in addition to our chemicals, a physical abrasion from the gauze. Back in the old days, the dermatologist would take that little Q-tip and gently paint it on. Well, this is more aggressive with using the abrasion of the gauze along with 1, 2, 3, 4 to get an excellent result. Now we do have Q-tips on the tray because we may want to use them around the eye or along the hairline or along the jawline in some of the areas that take more peel. So we'll do it all over and get a nice blanch. And if it's a small area along the ear that didn't blanch, we can touch it up with the Q-tip. So watch as we go through. Here we're using the Propeel number 1 as a cleanser. We don't use acetone wash ahead of time. We don't use Septisol cleanser. We just bring them in, hopefully with no makeup, and start our peel. So we take our little folded up 3x3 or 4x4 gauze and put a little bit of Propeel number 1 on it. And in our right hand we have the solution. Our left hand we have a dry gauze in case there's a run or gets in the eye so we can blot it, or they have a tear, we can blot it off. So we start on the forehead area where the skin's really thick, work around the décolleté area, and then go in closer and closer around the lips. Have them roll their lips in so we can do a nice peel on the vermilion border, and watch our gauze. Now it may take 3 or 4 coats of this gauze to get off all of the brown color, which are the old dead skin cells. After that, they may have a little burning. We actually have to give us a little thought about the burning. We say, well, on a score of 1 to 10, do you feel like it's really burning? And they may say with Propeel 1, well, maybe 1 or 2. But it gets them thinking about it, because as they move up on these solutions, my wife calls it hot peppers. The burning sensation goes up and they use more of the fan. So you'll see that as we go along. So here now we're progressing with Propeel number 2 and Propeel number 3. And you can see over here with the Propeel number 3, she's developed a nice foggy red blanch. This is our end point. This is what we want to achieve. She's holding the fan. When they start out with Propeel 1, it's kind of casual. They may have the fan on low to blow any fumes off so it doesn't bother their nose. And then as we get to 2, the fan's a little bit closer, and the burning index may have gone up to 3. And then we get to the Propeel number 3, hot peppers. They're holding that fan really close. And you ask them about their burning index, and they may say 6, 7, or 8. Some say 10. So we hold off a little bit on our next coat of our peel while they're holding the fan close, so the burning will subside. It only takes 3 or 4 minutes and the burning goes down. And then we'll go in with our Q-tip and touch the areas that haven't really blanched to make it nice uniform. We want a foggy red blanch from the hairline, décolleté area, earlobe to earlobe, so they get a nice uniform peel. Now here we're finishing up with Propeel number 4. The Propeel number 4 is very high, 10% vitamin A propionate, so it leaves this kind of a glow on the skin, and you can see that we've applied it. It'll even leave the skin a little yellow, but then they don't do anything. They go home and leave it on until they wash it off at night. But I want you to memorize these steps. This is Obagi level number 1, or we want to be, with the foggy white blanch. If we get to number 2 or 3 or 4, it gets deeper and deeper. It even gets on to the point of a gray blanch. It goes from white to yellow to gray, and we don't want to be there because you can cause scarring with the heavy TCA solutions, and we just want this little soft-boiled egg so we can watch the foggy red blanch. Now we know we're at the right level because we get what Dr. Obagi's called the epidermal slide. You take the end of your Q-tip and push the skin, and you can see little crinklies where you're pushing the Q-tip, which indicates that the epidermis and dermis have been disconnected. The desmosome has been taken apart by our peel, and it gives us the indication we're at level 1. Now if you get to level 2 or level 3, the dermis will swell up and stop the slide. So just keep an eye on it. You want to get a little bit of slide with our foggy red blanch and not lose it. So once they are done, they just hold the fan for 5 minutes until the burning's over. So imagine now they have a nice peel, but they also have these chemicals on the skin, so we don't want them to do anything. The big mistake they may make is to take like triple antibiotic ointment or a heavy moisturizer and put it on the skin. It'll work like saran wrap and block in the water loss and rehydrate the chemicals and make them a deeper burn. So they don't do anything for the first day. They go home at night, take a shower, and basically don't do anything on that first night either. If they want to, they can put on our day treatment moisturizer, but they don't really need it. So next morning they wake up, they use their cleansing milk to cleanse, and then they put on their morning moisturizer, and then at night they use the cleansing milk again, put on their evening moisturizer. And they can apply the moisturizer again during the day, but the first day they don't really see anything. It's a little bit dry, looks like a snake skin getting ready to peel off. The next day, though, the second day, they begin to peel around the mouth. So they need more moisturizer in that area. And then the peel will come across the face like a wave. The second day, third day, fourth day, fifth day, then it's gone. At that point, when the peel's done, if they have blotchy brown skin or the darker complected skin, we will start right away. Like on day 7, their bleaching cream. We use the cream, which is milder, doesn't burn this new skin, and it's called bleaching cream 222 because it's got 2% hydroquinone, 2% kojic, 2% vitamin A propionate. It's that triple formula that really works well to prevent any reactive hyperpigmentation from showing up. Then maybe around day 20, they can progress on to their old skincare kit, go back to their regular program until they're ready for another Propeel. So I want you to walk through with me as we show you some peels. This is a patient here, that Rosa, that had some blotchy brown. So Rosie used her even color kit, and then we started with her Propeel 1, 2, 3, 4, and you can see at day 2 she has some darker complexion. It's very common on darker skin to dump pigment. That pigment is sitting there, dumps into the stratum corneum as it peels off. So it's very typical for a darker skin to look darker before it peels. Now on me, a blonde, blue-eyed guy, I got no pigment, so I won't get dark. I'll just get white and peel off. This is showing her at day 2, which is starting to progress the peel around the mouth. At this point, she uses more moisturizer, and if a big chunk of peel comes, she can snip it off with her scissor. I don't want her to pull it, because if she pulls it, it may go out here where it's not ready and leave an irritation which ends up with reactive hyperpigmentation. So gently she can trim it off and put some moisturizer on, put makeup on top if she'd like, but then watch her as she progresses along. This is day 4, now the peel's coming out to this area, and then it peels off day 5 and day 6. Look at her day 6, brand new skin. She's very happy at this point, happy camper. But she's got to wear her sunscreen, stay out of the sun, and about this point, start using her 222 bleaching cream so she won't get any reactive hyperpigmentation back. So she's very happy with it, but remember we peeled her into the décolleté area, so day 2, 3, 4, 5, 6, then you got day 8 and day 10. It progresses on down the décolleté area, takes more time. If you peel them all the way down to their fingers, it even takes more time, like day 12, 13, 14 to get a peel this far. So the further away from your heart, the longer it takes for it to peel off. This is showing that big chunky peel coming off. You don't want to rip it off because you may get to an area that's not ready. Just snip it with a pair of scissors, put extra moisturizer on it, and it'll gently peel off on its own. I want you to walk through this patient with me, an Asian patient with his blotchy brown color. As you can see on day 1, day 0, we just finished with our peel and she's already started to dump pigment. So she's going to look darker right away. So all that extra pigment that's stored in the skin gets dumped into the stratum corneum before it peels off. Day 1, the next day, she's really dark, and then by day 4 it's peeling off. And you see with her skin that beautiful new skin that's developing without the pigment. And then at day 7 it's almost gone, and you see her at day 14, brand new, the blotchy brown gone, and she's applying her 222 bleaching cream, prevent it from coming back. Around day 20, she'll go on her even color kit. Now some people get a little bit back of their dark blotchy pigment, so we'll just push on with their even color kit and do another Propeel. They may end up with 3 or 4 Propeels in the first year to finally slough off all the pigment. This is a lady, with a lot of sun damage, keratoses, and she went through the same system we've been discussing and got rid of all that damaged skin. Now this lady here was from California, wanted to look lighter. Now imagine if you move that skin quickly, you peel off all those old dead skin cells, slough off that pigment, you're going to be lighter. So once a month she'd come in for a Propeel, and she stayed several shades lighter. Was quite happy, wore her day treatment sunscreen during the day, and liked her new lighter appearance. This is acne. We've discussed it before, but remember, you get these acne impactions, you want to slough them out with a Propeel, and it'll help our even complexion kit to clear up their acne, and they may need 1 or 2 a year, along with their nice program and acne extraction to stay clear. So it's kind of, we call it the Accutane bypass. This person is a little bit older, got saggy skin. So they went on the program, got on their anti-aging kit, had their microdermabrasions, had their Propeels. We pulled that skin up and got her looking rejuvenated, and she was a happy camper. I want you to walk through a couple cases with me in addition. These are like interesting cases. So another blotchy brown. The other one was Rosa, and this is Sarah. And she had a blotchy brown pigment. She'd gone on the Even Colors preconditioning program. So you see her here getting with her Propeel system. She's actually getting number 4 here with a high-dose retinol, the vitamin A propionate. You see a little glow here left over from putting on all the vitamin A. So here she is dumping her pigment right after the peel, right afterwards. She looks dark. All the old pigment's coming out and dumping in the stratum corneum. So tell your patients they're going to look dark if they're Asian skin or ethnic skin before they lighten up. If they're blotchy brown, they're going to get more blotchy before it peels off. Now this is her on day 1, starting to peel around the mouth. You can see it beginning to peel. And we now increase our moisturizers. We have to clip off any extra skin and keep it well matted down with this moisturizers. But I want to show you on day 2 an unusual reaction. Blisters form. Never seen this before, but I can imagine that in really somebody getting a really, really good peel, as instead of peeling, the lymphatics is going to pump out some lymphatic fluid and they'll get a blister. So see on her upper lip, she has a little blister, and see on the lower lip chin area a little blistering. So we just laid her down, took a sterile needle, and opened up the blister, drained out the lymphatic fluid, and boosted up her moisturizing program. And sure enough, everything peeled off. And I was really nervous, but look at the great result she got. So it's a very safe peel for all skin types. And here at the end, everything peeled off as normal, and I got her back on the 222 bleaching cream and her Even Color program just to make sure it doesn't come back. Now this is another patient. We put on Propeel number 1, and all of a sudden we got this blanching. I'm really nervous. What's going on here? But this is an inveterate picker. You can see here the butterflies, the little areas where we have a little blanch that looks like a butterfly. Those are the 2 fingernails coming together, trying to get out like an acne impaction. And you see this rapid blanch. So it means this guy, even though I didn't recognize it, is a picker. We talked to him, lectured, got his mother in there, and he promised never to pick again. But you can see that even after his peel, even after we got to step 4, though the white spots are still there. So when you're doing the peel, not only do you have to watch how quickly it blanches, but you got to watch how quickly it goes away. It should go away in like 5 to 10 minutes. If it's still blanched after 10 minutes, it was like too deep, and you really got to put that moisturizer on. So if you have a pick spot, you need to really super moisturize it to prevent the reactive hyperpigmentation. So he took longer than normal for the blanch to go away in every place he had picked because he had stripped off the stratum corneum. But he got a very nice peel. Look at this excellent result he's getting. He's actually getting a better than usual peel coming across his face on day 2, day 3. And you can see here a happy camper at day 6, all the peel's gone. He promises never to pick again and to continue on with his skincare program to avoid any further recurrence. But he may have to have a Propeel again in the first year. The average is 3 Propeels to keep his complexion refreshed and to keep the rosy red glow. Now there are some complications. An acne flare-up, not unusual with 10,000 pores to have like 1,000 pores impacted, and you're going to force them out with your Propeel. So ultimately they're going to get better, but the 10 days after the peel, they may look worse because we're flushing out these impacted pores. Just encourage the patient, bring them in for an extraction, really push their skincare program, do another Propeel, get out all the impacted pores so they get clear. This is reactive hyperpigmentation. That's why we want to make sure we go into the hairline all the way down the décolleté, because if you do get a little reactive hyperpigmentation and you didn't go, you can see a skip area, and that's what they see. So if we did a uniform job here, she may look like she had a little tan, but no big deal. If you have a line of demarcation, it's obvious. So make sure you do a little peel all the way from the hairline to the décolleté area to blend in. Remember our secret: blend, blend, blend. This is that persistent redness I was talking about. And actually what happened in her case was she had a new baby and carrying the baby around, and she got irritated in the bra strap line and got some persistent redness. We kept it really moisturized, and of course it went away. Redness and erythema is not a permanent problem, just temporary. Herpes flared up. We had her on antivirals, and rapidly it went away. So take a good history, and if they have recurrent herpes like every 30 days, you want to avoid peeling that area or make sure they're on antiviral medicine. So the trick is to put them on right at the day you peel them and give them 5 days of antivirals. There's no use starting 3 or 4 days ahead of time, but start the day or the day after your peel for 5 days to block this recurrence or flare-up of herpes. So in conclusion, we want to learn how to do this 1, 2, 3, 4 peel. It's safe for all skin types. It can be repeated monthly, and if you combine it with our Vivant skincare program and our glycolic microdermabrasions, you get excellent results, and you can build your practice on these troubled complexions. So thank you very much. This should be great for your office. It was great for our office, and you can become a Propeel expert. So thanks again for your attention.